We'll get started. I'd like to thank everybody for joining us today. Our webinar today is about your checklist for strategic patient engagement. And our presenter today is our EDI product manager, Chris Klein. And we will be recording today's presentation, so I will make this available to all attendees following today's session. So at this time, I would like to get started, and I do kindly ask that everyone continue to mute their lines just to ensure a smoother presentation. Following our presentation today, we will be setting aside to answer any questions or concerns you may have regarding the content that Chris covers today. So we kindly request that you do type these in the bottom right-hand panel of your screen, which is the Q&A panel. And we will try to address as many questions as we can prior to concluding at 2:30. We welcome you to connect with us on some of our social media channels if you haven't already. We do try to communicate lots of company information on a regular basis, so you'll be able to explore events we're attending and company and industry news and other information you may find useful, such as our upcoming UGM in a few weeks. For today, the breakdown of our agenda is as follows. I'll give everyone just a brief overview of Chris and her experience, and then we'll dive right into why patient engagement and why it's relevant to you and how you can use diverse communication channels and solutions to improve your overall patient experience and the care outcomes you're providing. We'll also go over our recommended strategic checklist, which will include different considerations and questions you should actually be asking yourself when building out a strategy plan to successfully engage with your patients. And these could be such things as questions like, are your interactions customized and personal, full? And also, are you reaching out to reschedule after patients miss an appointment? We'll also highlight some client experiences that may be of interest to you. And as I mentioned earlier, we'll conclude today's presentation with a Q&A portion. So here's our lovely Chris Klein. And we're happy to have Chris on the line with us today. Chris has been a NextGen EDI product manager for over 5 years, and she has over 40 years experience working in the healthcare industry. Chris is really passionate about patient engagement, and she's really knowledgeable about the different channels that will support your overall strategy to communicate successfully with patients, specifically using our own EDI messaging solutions. So Chris, thanks again for presenting with us today, and at this time, I'll turn the presentation over to you.
Thank you, Cassie.
You should have the presenter rights right now, Chris, whenever you're ready.
Okay, I think the slide changed?
Yes, it did.
Okay. Well, welcome, and it's an honor to be able to present this information to you guys. And I always love to do live presentations because you get to actually have interactions and see who's on the line. This month, October, is Breast Cancer Awareness Month, and we wanted to recognize people that are suffering and fighting and being treated, and also the people that are supporting this terrible disease, and as well as people that are researching and fighting and working and all that. So I did want to start off with that recognition. And then moving on to more lighter, I did want to go into a little comic, and I found this one, and I thought it was pretty funny. As you go to a thing and you get a lollipop. Anyway, so will it suffice for patient engagement? And the answer is probably no. Not these days anymore. Maybe unless it's pediatrics. But I think even still, the lollipop just doesn't work. when we were looking at how we can present this information, or better strategically to talk about patient engagement, we went back to the basics of who, what, when, where, why, and how. And those are really important questions. So as we go through our checklist, we're going to just follow through, and it'll be really easy to absorb. And as Kathy said, though, if you do have questions, we're going to be happy to answer those at the end. So just type those as we go along so that you don't miss it, you know, so that we get those and can address them. So the first one on our checklist is the why, and that really should always be the first question we ask about why we're going to do anything in life. And so why does patient engagement matter? Healthcare and military basically have the most acronyms of any industry or any language. Many times it seems like we talk from acronym to acronym. It also, we have in healthcare many, many regulatory changes that most of us have all gone through or lived through if we've been in healthcare, worked in healthcare, and they all affect us. So these days, you know, some of the acronyms such as ACO, PCMH, FQHCs, and so forth, they're like a second language to some of us, and some of us we have to Google them because we don't know what they are. But you know, everything we're hearing, and you know, we keep you know, really a good finger on the pulse in Washington, as well as at every state level and even program and county level, to make sure that we are keeping a NextGen as a whole is knowledgeable about the things. So we also offer a lot of information out there, but to learn about this. But value-based reimbursement is here. It's a reality, and so we you know, but the gist of it is to improve the health of our patient population, or as the population as a whole. It doesn't mean that it's our patients, but we also want to improve the experiences that they have, because they have a lot more selection of who they're going to see and what they're going to do, and also overall reduce the cost of healthcare overall. And so MACRA, that's another acronym we're dealing with, and that is the transition to the value-based care. I think at the end of this presentation or session, Kathy's going to cover some of the availability of sessions or webinars that are available for this, and you really need to keep learning and getting information from as many places as possible. And NextGen really does try to do that. And the goal of MACRA overall is to, and you can read this, I don't need to read off the screen, but it's really to make sure that because there's two sides of an equation. There's the people that are the providers that are going to get paid, and there's the providers that are going to get paid more, and there's going to be providers that get paid less. And we want our NextGen providers to be the one on the I think it's called the black side of the equation, where we want them to be paid. So we want to make sure that these solutions, through messaging solutions, population health, patient portals, are a way to meet the needs of both MACRA and all the different types of reimbursement that is the changes that are coming. So what kind of channels or outreach are going to be needed? And one that's probably the most important is that face-to-face, that in-person between the patient and the providers. But when that is not possible, or to make that a pre or post engagement, you want to utilize the resources. So the phone, IVRs, text, emails, portals, online solutions, mobiles, and remotes are really the different ways of transactions, of being able to interact, or interactions, not transactions. So the whys continue. And this is a recent study that was done just in August of 2016. It's a poll that 60% of folks I guess that's called people, even, you know, regardless of that age bracket, are willing to engage electronically with care providers. And that is on the rise. And a lot of these statistics, even though they're in print, they're, you know, there's studies that have been done, some of them I look at and I go, well, duh. I mean, we can see it in everything we do on a day-to-day basis, and not just in healthcare. So when we do look at healthcare, we have to take into consideration the United States as a whole and the different demographics. And so when we look at just that SMS or text messaging, there's been a few recent studies. I try to look at something that's been done within the last 6 months when I do my research. But the NIH, you know, has been doing a 10-year study. So there's some really long-term studies that have been done. And this one's saying, what is the, you know, success rate of, does the appointment reminders help in bringing positive results? Like, do patients come in with these types of reminders? And for everything that we've seen, you know, there's that we can increase the appointment attendance by 50%, and that's the health services research, as well as a Kaiser Permanente study that really shows you the ROI or the cost savings. So when we're talking about MACRA and we're looking at overall operational costs, we want to look at how can we implement certain types of processes and solutions that will then have a direct correlation to why. You know, why do we want to have patients loyal to us? Well, they could go to other providers or other, you know, other organizations. We also want to have educated patients, because the more information we can give them in a digestible fashion, that will have, hopefully, you know, and this is what studies are showing, we'll have a healthier population. And then, of course, decreasing those no-shows, because schedule management, making sure that we are working to the most efficient way possible, and being effective, so, you know, staff productivity. So there's a lot of, and then increased patient satisfaction. I could go on and on about the whys, but now I'm going to go on, you know, because we only have so much time. I want to then hit the whats. And so the whats are really, I'm going to cover the NextGen EDI Messaging Solutions. And these are all things that are available right now. Many of you might be already using some sort of appointment reminders. Maybe you're using NextGen EDI for those appointment reminders, or you're using an outside vendor. We want to always make sure that we talk to our clients to let them know about what are the advantages of using our NextGen messaging and the appointment reminders, and even using our population health and having that whole integration part of your workflow. So I'm going to start, you know, I'll repeat myself over and over, but it is just drilling home what these advantages are to you from a workflow situation. So when we do appointment reminders, if you're utilizing our NextGen appointment reminders right now, we want to say that there's a lot more going on. We've brought a lot of functionalities because we listen to our clients. We also look at what the regulatory things are that are going on, and we want to bring more functionality. So adding to what you're already doing, your existing processes, is really important. And so utilizing, and this is like through best practices, and looking at how can I get better, you know, how can I improve what we're doing right now by adding follow-up or supplemental reminders. So we've already sent out a reminder a week ahead of time. Let's 2 days out send a supplemental reminder just to follow up with that. And we have seen huge successes with those. And then just-in-time messaging. This one right here, for me, is wonderful because I get really busy during the day, and I think a lot of people do. I'm not odd. Well, anyway, so the just-in-time is like the morning of, you know, hours before, just a friendly reminder, a text saying, or, you know, depends on how you want to set it up. We can configure it different ways. But I want to get a little text saying, oh, you know, we know you confirmed, but we're looking forward to seeing you today at 10 o'clock. And so I thought, oh, I better close up my, you know, thing and, you know, stuff I'm doing. Well, all of also, when I get there and I have to wait, even though I left my job and I have to like sit in the waiting room because I find out once I get there that the provider's delayed, we can handle that by using a portal, and our clients log in and can send out bulk messages or individual ones to certain patients that they need time to catch up. They want their patients to come in a little later, so we send out these messages once you set that up. It's very simple and easy. It's within, the way you do business. And then the other way is provider ready now. So notifications. So these are messages that are sent out. It's like, oh, we caught up, a patient canceled, big procedure might have canceled. We want to see you earlier. I would love to get something like that. And then it says inclement weather notification, and that might be true for a lot of our clients that might use this, but it can be used in other situations, and that is where you need to bulk reschedule a whole half a day, a big block of time for providers, locations, resources, and be able to send those out. Maybe your water main breaks. It doesn't all have to be around weather. It could be used where, just an example of OBGYN, doctor gets called out for a birth, and you need to, clear out the whole afternoon. Sending those messages out to contact the office to reschedule. It's just a lot of these little messages seem to be little, but they're not. They're very impactful. And then as I go down the list, the satisfaction, through looking at patient loyalty, having that net promoter score, would you recommend? It's a one-question survey, and that can be sent out via voice, text, or email. And just to let you know, even though I didn't say it earlier, but all of these types of messages can be sent out through voice, text, or email. And birthday messages, there's all kinds of fun stuff we can do with that, videos and pop-ups and of your staff and stuff. It's very customizable and personalized. Balance reminders, making that balance part of the conversation up front. So the patients are going to come in for an appointment. You want to make sure that they know that they do have a balance, so that you can do a voice, text, or email for that also. I'm hearing a little background noise. Cassie, if you could mute someone.
Sure. Sorry, Chris. Thank you.
That's okay. And then, summarizing these, and I always like to say last but not least, the recall and no-show reminders, making sure that you follow up and care about the patients. If they miss their appointment and then they don't have anyone follow up from the office or the organization to see if they could come in, why they didn't come in, there might be really good reasons. And, I've had it to where I don't get any follow-up at all, and then it goes away. But how do you know it's really, the symptoms might go away, but the actual problem might still be there. And so for the better health of patients, no-show reminders are very, very important. And they also drive new appointments. So to bring that, to bring that patient back in, that'll drive new appointments. On this slide, they're a little small, but I think you can see the professionalism. And all you have to do is where it says NextGen Healthcare, just imagine your own logo there or your own organization name there. We just used our own so that we could not, target anybody. If I put ABC Orthopedics, there's probably an ABC Orthopedics out there. And these are just samples of, on the left, is an appointment reminder, and as you can see, there's a lot of features that are really useful. Adding to the calendar, there's maps, like to Google it. Also, two-way communication. I don't think I said that on the other slide, but in voice, there's a hot swap where you can press 1 to be transferred to the office. There's that kind of feature if you would want to utilize that. And then there's always that reschedule appointment or confirm. So these are things that make it easy on your patients. You want to be able to communicate effectively and make it easy on your patients to be able to respond back. In the center is a patient survey, and this is what I talked about having that 1 through 10, rating 0 through 10. And these are actionable, and everything can be sent out to a task and be able to, follow up with if there's any bad survey results or, and there's just too many features to talk about all in this short time. So I'm really high level discussing these. And on the right is the balance, a balance reminder text, and it looks, we're very limited by the amount of information we can put in there. We're also, one thing I want to mention with all of our appointment reminder, all of our messaging, we're all under the HIPAA compliance and all the other regulations that follow for any type of texting or emailing communication. So that's very important that you work with that whole compliance that NextGen umbrella does bring to the table. And that we do, we are the NextGen developers, the NextGen, QA people, everybody is involved in this. And most important, the way I look at it, is our messaging specialists. And so they work with you to take any type of script or generic script and customize that to make it personalized by the event, so and then also the resource, and then the location. So these can all be customized that way. So that really is the what of it, and there's a lot more to it that I can't cover in this short time. And so I'm going to move on to the hows. And the how is really how do you communicate? And it's not just communicate with patients, it's how do you effectively communicate with patients. You want to make sure that it's automated, that you don't just have to do things on a manual, looking at a screen, printing out reports, dialing phones, utilizing staff time very inefficiently. So by automating these notifications and then personalizing them to each event and the patient's appointment, as well as customizing them, or not by patient, making sure that you are communicating with that patient in the way that they want to be communicated. So it's called preferred method of contact. So we want to make sure that we're always utilizing that. And you want to make sure that you're helping the patient make the appointment and come in to that appointment prepared. So with directions, with balance, with, there's a lot of other stuff, lab instructions or just instructions in general. And that's the ability to be prepared. And then customize for the unique needs. And then make it a real personal experience, follow up and care about how was your appointment. When they leave, that post-care is very important to be able to follow up on, and there's a lot of times we lack on that, and we want to make sure that that's part of effective communication, and that whole patient engagement is not when they're just face-to-face anymore. But this is all made possible by working with our messaging specialists or our analysts that have years of experience, and this is their specialty. This is what they do. And so they make sure that everything that you're doing works within your workflow, as well as they know NextGen very well, so they know how to make sure that you're utilizing the tool that you already have, and being within your workflow, and also being best practices. And that's going to end up with a whole, not only happy patients, but you're also going to be having happy staff. So then the who of our questions, and that is the patient. The patient's the center of all of this type of engagement and all of this communication. And then it's surrounded by the different forms and ways of communicating. I also say the who might be you guys too, you know, your staff, your providers, you know, that you're also part of that communication. The where. So the where you're communicating with patients could be through NextGen EDI, the NextGen practice management system. You're utilizing that software to be able to communicate with, you know, your patients effectively. Also online through the patient portal, the NextGen patient portal, as well as NextGen Care. So with messaging solutions, I went over the what, so that really does fit into this, but it is fully integrated. So any of that feedback that comes back goes directly into, if it's the scheduler, if it's in, you know, through the BDP into the work log tasks, and it's fully integrated into NextGen, so into the scheduler and so forth. And then utilizing the, as I said, best practices. I've already said a lot of this stuff, but really it increases patient engagement and overall quality of care. And so then the patient portal. So the NextGen patient portal is fully integrated into the NextGen, both the practice management and our EHR. And as of July 2016, this was a really interesting statistic I saw, is 2.4 million patient logins for the NextGen patient portal. That's huge. And so that shows that this is an area where communication is back and forth, two-way communication from the providers, from the staff, and as well as from the patient being able to access, not even mentioning meaningful use. So, you know, that's where the NextGen patient portal comes in with the strengths. Some of the statistics that I've seen for how people pay their bill, they usually do it after 8 o'clock at night and before 7 in the morning. So having that 24/7 access to be able to view your patient statement and then also pay those bills online. And then that just drives that communication for when they can make appointments, review lab tests and results, renew prescriptions, and much more. But it really does increase the communication. My mom is 86, and you know, I always kind of judge her of how she does it. She's on the patient portal herself, and it's just, you know, we're seeing that more and more where if it's not the patient, then, you know, sometimes, you know, there's that you can have someone else you can assign to be able to do that too. So there's just some really great functionality there. And then NextGen Care, and that is, if you have heard other terminology of population health module, but it basically is an extension of our NextGen EHR to communicate effectively and run campaigns, also be able to do a lot of patient engagement, actually data sharing and doing most of that whole collaborative care type of functionality. And we have a lot more information that you can access on both NextGen Care patient portal as well as our NextGen EDI messaging solutions. So that was where was I? The how? Where, that was the where, sorry. Now I'm at the when, and the when is a good one. The when is now. Oh, Cassie, it's not going. We had it, it's so cool. This little clock was going. Anyways, that's the fun part of putting these PowerPoints together. You want to make them interactive. But the when you should start communicating is really now. You should be putting things in place. Even though some of the regulatory details are not finalized, any of these types of increased communications are, you know, there's a direct correlation between your patient care as well as your business. You know, being able to do business the best way is really making sure that you plan ahead for appointment reminders, you know, that they're notified in advance, following up and doing supplemental reminders to ensure patients arrive. also communicating those last-minute scheduling changes, making sure that you don't have upset patients when they do arrive, and having happy patients. It makes a big difference. And then, making sure that you're outreaching for no-shows, as well as, that whole patient experience and following up with those patients from a patient experience. And so when can that happen? And, you can just open up a ticket if you already are using our NextGen or EDI messaging, and that's as easy as it is. If you do not, you'd want to talk to your salesperson or really reach out to your customer care rep, however that works, but we can assign a NextGen messaging analyst. Also, if you have any questions about that. So that's really, we want to say now, and we want to make sure that whatever you do, that you're being configured by the way that you do business, and not just, but what you're meeting the provider needs, your patient needs, and you're doing it within your workflow. Those are all just really, really important. And then speaking of important, when we hear good things back from our clients, it just really, besides making our what we do, shows value to what we're doing, but it also shows an impact of that we're doing things right and we're on the right track. And that's, as a product manager, that's really important for me to make sure that we are listening to our clients and also the industry and coming up with solutions that work. And so with core physicians, this is Jane. You might have seen this at our, if you've been to one of our user group meetings, we've used this in the past, but we want to, I like to really show that, that we are, looking at these testimonials and seeing that we're having an impact in reducing appointment no-shows, and also, making sure that we're letting them be, more efficient in what they do on a daily basis and leaving time to work, smart. So the second one we have here is Wilmington Health, and this is Lisa Perry, and a little about what Wilmington Health is, because we always like to, give kudos to our clients that we love, and I do mean that very sincerely. But it's what I loved about this one is that we are a true partner, and we're giving them avenues of communication that were new to them, that they, and that we were listening to their patients. And then we were having an impact of decreasing the no-shows, and then having patients arrive on time, and then being able to notify of things, changes. You have a new location. You have, so we make it really, really easy for them to communicate. So I'm Kathy at this point. I'm wrapping it up, and we're going to try to leave some time for some questions.
Thank you, Chris. So this next slide is just to remind everyone of how you can sign up for future NextGen Healthcare webinars. We post a handful of webinars each month, so please take advantage of these opportunities. And Chris,
another thing is we have What's Next newsletter, and there's a tab at the top that has like learning or something, webinars and stuff. That's a really great way to be notified also of upcoming webinars if you don't just pop out to this area all the time to check it. We also try to do, our marketing does a great job of trying to get those notifications out to our clients.
Thank you, Chris. I did also want to mention you can sign up for webinars additionally on our Success Community portal as well. And we do have educational webinars to help with your transition to value-based care. That was something Chris mentioned earlier in the presentation. So I know we're a little past time. I did want to move on and answer some questions that did come in. If you have a few more minutes, Chris, I'll just dive right into these if that's okay with you. The first question is, how does the patient respond to the message they actually receive?
Well, it really depends on how, the preferred method of contact. So if they get a voice you know, depending on the message and also. But if it's, I'll just take an example of a voice reminder, and they want to confirm it. There's instructions in there to say, you know, press 1 to confirm, or press 2 to be transferred to the office to reschedule. So it's really just either a confirmation or a way of communicating back and transferring that call back, which is called a hotspot feature. And then with text and emails, the instructions are on there. It'll say like C to confirm, and you know, so we have that two-way communication on all of our messages that we are communicating back to our patients.
Thank you, Chris. Another question is, can we send specific messages to certain patients?
Oh, that's a good one. Yes, there's there's ways of through the configuration, and when we first implement, we can set it up a certain way. But by just opening up a ticket, we're really able to customize specific ones. Otherwise, if we've already set our clients up for different types of messages, they can reuse those and change the scope of the patients that they want to select. So, by event or location or resource. So there's a lot of different ways to filter and make sure that the patients are getting these messages that, you're communicating with the correct patients.
Thank you, Chris. Another question that just came in, what about patient diagnosis?
What about patient diagnosis? That's actually the event, isn't it? I might need Jacqueline on that one. But it depends on what the communication is for that. So Jacqueline, I don't know if you can unmute yourself if you have something more to add in there. But usually that event follows by the diagnosis itself, because most of the time when they, these messages aren't going out directly from what has been posted in for like the ICD-10. Jacqueline, I see you're unmuted.
And I'm sorry, can I just chime in here? For example, like diabetes. Or I'm sorry, for example, like diabetics in need of HbA1c. That was the example.
That would be, that's handled very nicely through our population health module, or NextGen Care or NextCare. But Jacqueline, you're on the line now, so I think that you are so much more better suited to answer that question.
You answered it very good, Chris. The diabetes HbA1c by patient diagnosis would be handled through population health. EDI does work hand in hand with population health to send out the voice reminder piece, but that would be handled more on the pop health side versus messaging.
Thank you, Jacqueline. So I just wanted to wrap up with the last question. How can we do something about patient survey results?
Do you want to handle that, Jacqueline, since now you're on the call?
So patient survey results, how the message is delivered and the actual delivery status is imported back in to the account note. However, if it's actual analysis for a multi-question survey, we do direct you out to a dashboard that would provide more analytics, based on the provider that you're maybe surveying or the overall office experience.
Thank you, Jacqueline. All right, I'm going to answer one more final question that came in, and we'll have to wrap up after this just because we're past 2:30. The last question is, can you send a message to those patients that give you a high satisfaction score to ask them to review you on Google? Can we add in a link to Google to increase the star rating?
Yes, so within the actual survey, depending on how the patient rates you, let's say if you say anything under 7 or anything over a 7, you want to go ahead and display the Google link. We're able to do an interactive type questioning and display that URL to them based off of their response.
Thank you, Jacqueline, very much. So I just wanted to remind everyone we do have contact information up on the screen right now. Please feel free to reach out to Chris Klein or myself if you have further questions about patient engagement and messaging solutions, or if you're interested in scheduling a personal demo, we would be happy to assist you for that process. This does conclude today's presentation. Special thanks to our presenter Chris and our panelist Jacqueline for their participation, and thank you to all attendees who participated today. We appreciate your interest, and we look forward to hearing from you. Please feel free to reach out again to our team if you do have further questions. And have a wonderful afternoon, everyone. Thank you.